This is the interpreter speaking, American Sign Language interpreter. I don't see any world icon or any dots to click or anything.
Yeah, neither do I.
Yeah, same here. I asked a question on the chat.
Give me one moment, please.
Okay.
Thank you. Everyone, if you can hear me, the interpretations room should have been loaded and you will need to go to the English channel.
Yes.
Thank you.
See you, Jaleesa. Wonderful. Thank you.
Sorry about that. Were you guys able to get it functioning? I see the interpretation globe at the bottom already.
Yes, we were. There was a little delay because some of the interpreters aren't present, so it wouldn't let me start until I removed them.
Okay, and then Mr. Zoe is part of our Korean team.
Okay.
And we also have a change in our Cantonese, and it's gonna be the last name is Bobrovcan.
So you're saying Jay Zoe is a part of your Cantonese?
Yes, part of the Korean team.
Korean, okay. And the other individual?
Is gonna be ZHIMIN.ZHAI@gmail.com, and he's our Chinese interpreter.
Okay. I don't technically see him on just yet,
Okay, let me.
but I will.
Yeah, that way you can add him on the settings. Let me send that.
Yes, thank you.
I just signed in. I've been waiting half an hour, but since doesn't connect, I resigned. My name is Jay Zhou.
Yes, thank you, Mr. Zoe. You're part of our Korean team, correct?
Yes.
Yes, all right. You should be getting assigned as an interpreter already. You should see that as an option already.
Jay Zoe. Okay, and Jay Zoe is for Korean?
Yes, ma'am.
Yes.
Thank you.
I sent you guys a message through chat.
Is everyone in their respective rooms?
I believe so.
Mr. Jay Zoe, were you able to? Hi.
Hello. Do we have Dr. Tanya as the chairperson tonight?
Yes.
And where are you located?
I'm in Jersey City right now.
Okay. So you'll be conducting the hearing?
Yes, I will.
Okay.
Hi, can my Spanish interpreters hear me? Please let me know if you can hear me, Spanish interpreters. Okay, I see Stephanie. Anybody else? Who's that? Noemi Valdivia. Okay, who's gonna go first, Stephanie or Ms. Valdivia? Stephanie's gonna go first? Okay, perfect. Thank you very much. I'm gonna go ahead and switch into the other ones to test the other rooms, okay? Thank you. I will send you guys my phone number via chat in case you guys, well, we can't even do that. I'll go ahead and write down my phone number. And if you guys need me, you can text me. My number is 832-265-1722.
Hi, everyone. I just want to let everybody know that we're not live. So Dr. Raja, if you'd like to start the meeting.
Will do.
One second, please. We're finishing up that setup with the interpretation just to make sure all of our logistics are in place. Just 1 second.
You can speak.
Can Chinese interpreters hear me? Can the Cantonese interpreters hear me? Are you in the correct channel? If you can hear me, please reply.
So Eric, we started already the public hearing, so this is on record. So if we could have
Okay.
Dr. Raggio start the meeting, please.
Go ahead.
Okay, all righty. Good evening, everybody. If you have either Zoomed in by computer or called in, this is the New Jersey COVID-19 Task Force on Racial and Health Disparities. It's our virtual New Jersey public hearing. So before I get started, I'm going to request the interpreters to provide instructions on how to use the interpretation features on Zoom. Unfortunately, those features are not available by phone. They're not fully available by phone, and they will explain that. Thank you.
Okay, as stated, for everybody tuning in, you can tune into our different languages by the interpretation setting at the very bottom. If you're on the computer screen, you should see that at the very bottom of your screen, next to your reactions and or interpretation, there's a globe. You should be able to select the language. You do have to select a language, even if you are in the current channel and you can hear me. Everybody else will be in the English channel and or Spanish, Cantonese, or Korean, or American Sign Language. Please tune into one of the following channels in order to participate in the meeting. Para todas las personas que estén escuchando este mensaje en español, tenemos la opción de interpretación para que ustedes puedan comunicarse con nosotros y participar en la junta. Para participar, lo único que tienen que hacer es entrar a las opciones de interpretación y hacerle clic abajo si es que tienen esa opción. Si no, deberían haber 3 puntitos para poder entrar a esa interpretación y escuchar en el canal de español.
En inglés, ¿no?
Ajá, disculpe, para que pueda escucharla en español, el canal en español, pero todo lo que se está diciendo en inglés.
And sir, what is your name, please, for the record?
My name is Eric Romero. I'm the project manager
Project manager.
for the interpretation team.
Thank you.
Okay, if one of our Chinese interpreters could please do the instructions in Chinese in the regular channel, please. 来, could you please give the instructions in Cantonese, please?
And I will need the names for the record before we start, okay?
We cannot hear you. If you could enter the regular channel, not the Cantonese channel, go into the original audio interpretation. While we figure get Lai to get on, Jay, could you please give those instructions in Korean, please. You have to be on the regular channel, not the Korean channel, please.
Hear you.
Yes.
Yes.
It looks like they're already in the respective channels.
Yes, say your name and then you translate what Mr. Romero said in Cantonese, please. Eric, I think she needs you to repeat your message.
Can you hear me, Lai? Okay. Lai, if you could enter Lai or Miss King, if you could enter the regular channel instead and give those interpretation instructions, you should be able to click on it in the in the channels. Can the Chinese interpreters hear me? Okay, we can't hear you. I can't hear you at all.
Yeah. We hear her.
I'm sorry, can you hear me?
Yes.
Okay, all right, perfect. Can you give those instructions in Chinese in the regular channel, not in the Cantonese channel, in the English channel?
Yes. Yes.
Were you able to do that?
Yes, she spoke in the English channel. You may be in the original channel, but if you're on the English channel, you can hear her. Everyone, if they're on the English channel, should have been able to hear her.
Okay, perfect. And then that was the Chinese interpreter that did that already?
Yes.
Okay, perfect. Then we have Spanish. Let me get the Korean interpreter to do it. Okay, can you go into the English channel and please give the instructions in English, please, or in Korean? Okay, yeah. So no. Go into the English channel and give the instructions in Korean in the English channel so that they can connect into the Korean channel. So in order for them to connect, all they have to do is click on the little globe and select Korean. Yeah. No. Don't click sign language. Go to listen in and click original audio, and I want you to speak in there. Okay, so yeah, go ahead and try to talk in that channel and let people know. Exactly. Speak, go in English and speak Korean and let them know to switch to the Korean channel. Once you finish the instructions, go back into the Korean channel. Hey, I can still hear you in the Korean channel. So you did it in the Korean channel. You didn't do it in the English channel. I didn't hear you. Let me see. I'll do it again in the English channel because I heard you in the Korean channel, but not the English channel. Okay, can everybody else hear Mr. J?
No.
Oh, I couldn't hear it in Chinese
Mr.
or
J,
in,
you're still in the Korean channel because I switched back to the English channel and I can't hear you. I can hear you in the Korean channel because I'm in the Korean channel.
Very good. Very good now.
Yes.
Alrighty, thank you. No. You're going back to the Korean channel. It was just to give instructions in the English channel. Go back to the Korean channel, please, and interpret there. Yes, you're going to be talking the whole time alongside simultaneously. Just go into the Korean channel, please. So we are offering interpretation services in Korean. In order to get to the Korean channel, that all they have to do is click on the little globe at the bottom and click Korean, and they'll be able to hear you once you go back to the Korean channel. Okay, you switched back to the Korean channel before you did the instructions. The instructions need to be said in the English channel, please.
Hi, Eric. I'm sorry, we're running a little behind. Is there any way you can maybe do this on a phone call with him to try to resolve this issue?
Yes, ma'am. Thank you.
Thank you. Dr. Raggio?
Okay,
Dr. Roger, if you could start the meeting, please.
okay, just stay in the Korean channel, okay, and we'll move forward from there, okay?
Thank you. Thank you. All right, we're gonna get started. Everyone who is either zoomed in on your computer or called in, this is the New Jersey COVID-19 Task Force on Racial and Health Disparities Virtual New Jersey Public Hearing. And it's December 6th, 2022. All right, I'm calling this meeting to order. And we are now on the record. Please feel free to reach out to your friends, colleagues, family to join us as we discuss COVID-19 health disparities issues tonight from 4:30 till 8 p.m. Okay, good afternoon, buenas tardes, and in all of the languages we speak in New Jersey. Thank you and gracias. Hello, everyone. My name is Dr. Tanya Pagan Raggio Ashley. I am the chair of the New Jersey COVID-19 Task Force on Racial and Health Disparities. I want to thank all of the members of the public for being here today to share your story. It is a pleasure to be with you this afternoon and this evening to hear about the challenges you've been facing concerning COVID-19, as well as successful collaborations to address them.
Jay, I can't hear you. Please unmute yourself.
I'm sorry, someone just said they couldn't hear me.
Oh, you're good, Dr. Raggio.
I'm so sorry. I'll repeat myself.
No,
Forgive
no.
me. Oh,
No, you were good.
okay. With me today are members of the task force. I'm going to ask each of the members of the Okay, all righty. I understand instead of the members introducing themselves due to time constraints that Araceli and Jalissa are going to name the members of the task force. Forgive me.
Hi, everyone. So our task force members are Dr. Julianne Presley, Candice Alfonso, Amanda Medina Forrester, Kaya King, Lisa Sare, Sybil Chota, Eric Apar, Erin Michelle Williams, Lieutenant Lee Carvalho, Tina Vignali, Marilyn Cintron, Damali Campbell Paraji, Gina Marie Miranda Diaz, Anthony Welch, Marie Carl Vilsius Talti, Aishia Hayes, Natasha Dravid, Marissa Davis, Maisha Simmons, Natalie Roche, Reva Foster, and Thomas Rafael Ortiz.
Sally, okay. And let me just say, I want to thank everybody for their patience. You know, this is the first time we're having a virtual hearing. And because we're so diverse in New Jersey, we really want to make sure that people can listen as well as be heard in the language that they're most comfortable speaking and communicating with every day. And you'll hear more from our wonderful task force members throughout the evening. Okay, so we'll begin with some background information on why we are here today. Then we'll briefly describe the purpose of the hearing and how your comments will be utilized. It will then be your turn and your time to provide comments. The task force members may have questions after your comments. At the end of the hearing, we will provide brief closing statements. So a little bit of the background. The task force was established pursuant to Public Law 2021, Chapter 106, on July 11th, 2021, by our New Jersey Governor, Phil Murphy. And the task force was convened a year later on June 2022. As you heard from Ms. Araceli, the task force is comprised of 23 members. We are charged with conducting a comprehensive study of how and why the COVID-19 pandemic has disproportionately affected and impacted minorities, communities of color, marginalized persons, vulnerable communities in our great state of New Jersey, and to investigate short and long-term consequences, such as long-term COVID. Though the task force is developing policy recommendations to address these issues, and we will report these to the governor and the legislature, as well as the Commissioner of Health, as soon as the conclusion of the task force in March 2023, we are interested in hearing about the challenges the New Jersey communities and you are facing, which need to be addressed immediately, such as questions about access to services, vaccines, COVID-19 medications such as Paxlovid and monoclonal antibodies, and more. Recently, you may have heard of or read about a CDC study confirming what we in New Jersey already knew and are acting on. And that is that people of color are less likely than white persons to receive COVID-19 treatments such as Paxlovid. You may have also recently heard that the rates of COVID-19 have increased by approximately 22% all over our great nation. The purpose of this hearing and public comment period is to solicit and receive testimony from members of the state's minority, communities of color, and marginalized communities based on their experiences with COVID-19. We want to take a moment to acknowledge and respect the great losses due to the COVID-19 pandemic. We also want to recognize the many who are struggling with long-term effects of COVID-19, while recognizing access and services have been more challenging for some populations and some individuals than others. We want to hear about these challenges, as well as how you may have overcome them, so we and others can learn from you and hopefully prevent them from continuing and happening again. Procedures for making comments. I want to repeat, as you can see, we have 2 wonderful sign language interpreters. We also have interpreters for Cantonese, Spanish, and Korean. If you are interested in speaking and providing testimony, we request that you use the chat box on your computer to provide your name. And if you are representing a group or organization, please provide that information as well. If you have dialed in and not entered through the Zoom channel, either on your computer or your phone, please dial *9 to raise your hand and submit yourself into the queue. I'm going to repeat that again so that everybody understands what to do. If you are interested in speaking and or providing testimony, we request that you please use the chat box on the Zoom link, either on your computer or your phone, to provide your name. And if you are representing a group or organization, please provide that information as well. If you have dialed in or called in and you are not on Zoom, please dial *9 to raise your hand and submit yourself into the queue. Also, if you require interpretation, please indicate that when you submit your name as well as the language needed. We will call you in the order in which the names appear and then receive your statement. To ensure that the hearing is conducted fairly, we will abide by the following additional rules. When your name is called, please come off of mute. State your name, correct spelling, any group or association you may represent, and your municipality. Each person will be given approximately 3 minutes to make their comments. We will indicate when you have 30 seconds left. Please begin wrapping up your comments and then end within the allotted time. Speakers may have the opportunity to make additional comments after all other speakers who are waiting have been heard. If anyone wants to submit written comments, you may submit them through the task force website at www.nj.gov/health/NJCDTF, also by email at njcdtf@doh.nj.gov or by mail at a later date. We will also post this information shortly in the chat box. Written comments must be submitted by December 16th, 2022. Written comments must be submitted by Friday, December 16th, 2022. The mailing address can be found on the website, and we'll also, for those who are calling in, we will also provide the mailing address shortly. Please be courteous and respectful to one another. Keep yourselves on mute if not speaking. Again, please keep yourself on mute if you're not speaking, otherwise it'll be difficult to hear one another. Only one speaker should be speaking at a time, and please do not interrupt the speaker. There will be no audio or visual presentations at this hearing. This hearing is being recorded, and your comments will be part of the information the task force considers in making its recommendations for the report to the governor, legislature, and commissioner of health. Let us begin. So we're going to start with the first speaker. Okay, my understanding is the first speaker is Ms. Sol Salazar. Ms. Salazar, if you can hear me.
Hi, how are you?
Hi, Ms. Salazar. Am I saying your name correctly?
You are saying it perfectly. Thank you.
Good, welcome.
Thank you. I have two sides of this story. I just don't know which one is more important to share. I actually worked ICU in St. Michael's Hospital, so I saw the effect that this had on our community firsthand. The majority of the people that passed away, the effect it not just had on the health side of things, but also on the mental health that it caused the families as well as our staff. We saw our patients, go through what they had to go through, families go through the crisis, had to tend to that. We also had our nurses and our staff go through mental, uh, despair per se, and even suicides, from our staff. So it was very tragic. It was very hurtful, and obviously, it's terrible when you're taught to save lives and you have so many slip through your fingers. Based on the community side, from my observations, a lot of the people that passed away had diabetes. So I think that that's something that's definitely that I've been talking to Project Ready, which I'm associated with as well, just so you know, to be able to state and do something about, hopefully, in our communities. It's just getting everybody to a better state of health. So hopefully we don't see that many tragedies again. And definitely helping everybody on the mental side, because it caused a lot of tragedy, and a lot of mental, despair, to say the least. On a personal note, I had the injection, and I had a terrible reaction of 9.5 months. Everybody's aware of that. The government followed me for that to get all of the, follow-ups. But I was actually let go of my job because I was left with no immunity due to the medication they had to give me, the amount of steroids and things like that. So after serving for the pandemic, I was kicked out of the hospital for it as well, because I had to get that injection, and I was mandated to do so. So it's kind of a double-edged sword here. I think that that's an overall good. I don't want to take up too much of the time because I can go on with this subject due to my personal experience with it. I just, want to be fair and give everybody time. But if you guys want to come back to me, I'm more than willing to share a lot of what I've seen, and, what I would, what I could suggest, or just observation alone.
Ms. Salazar, I hope you can hear me.
Yes, ma'am.
First of all, I want to say thank you. I'm truly sorry for what's happened to you and your colleagues, and of course, the family and individuals you cared for. I also want to thank you for your service,
Thank you,
during
Ms.
the pandemic. We do have task force members who may want to ask you questions. Are you comfortable with them?
Yes,
asking?
absolutely. Absolutely.
Ms. Salazar, and then that may afford you an opportunity to speak on some other issues. So I may need please be patient with me because we're doing this virtually. Does anybody from the task force want to ask Ms. Salazar a question? If so, could you kindly raise your hand, and we'll call on people. Ms. Cintron, the co-chair, by the way, she's the co-chair of the task force, will assist me in calling upon individuals from the task force once I see their hands up.
I would love to put my hand up. I can't seem to find it.
Oh, Dr. Ortiz, that's okay. I have that problem sometimes too. But why don't you be the first person to speak?
Have a quick question. You talked about getting the injection and being sick for 9 months. Can you elaborate a little bit more as to what happened? What injection you talking about and what happened?
Yes, absolutely. So I got the Johnson & Johnson because I did wait till the last minute. That was the only thing available at the time. And within 4 hours, I was in the hospital with hives from head to toe. I had all the reactions. I had the chills, dizziness, fell, and then broke out in hives from head to toe. The hospital gave me steroids intravenously as well as Benephin. And nothing, it took it away momentarily. Within an hour, my body was reacting again. So it was just continuous. It was trying to get a hold of it. The only way that we were able to control it, I ended up taking 90 milligrams of steroids a day and taking 6 Zetrazine a day and popping Benefens as if they were Tic Tacs. That's so that, and that took, then, you know, that steroids take your immunity away. I was left with that. That's why they pulled me out of the hospital. And so then we had to try to get me off of the medicine, you know, throughout that time, but making sure that my body wouldn't keep reacting. So I went to the hospital 3 times due to the reaction being so severe.
Yeah, I can clean up things and then it'll automatically update when we hit refresh.
Sharing that. My name is Marilyn, I'm the co-chair, but I'm also the chair of the Communications Committee. And I thank you as well for your service, and I'm really sorry that you're going through the side effects to that extreme. When the pandemic first started, and we were, you know, as being someone on the front lines, how do you feel that the communication flow came about with COVID-19? What was good and what wasn't good about the communication while you were actively working on the front lines? If you don't mind sharing that.
I believe that we were doing the best that we could with the information that we had. I think that the most difficult part for us as a team was the doctors did not want us to do resuscitation due to, you know, obviously contagion and stuff, but it's hard. You're seeing a human pass away. So we didn't do breath, you know, mouth to mouth or anything. Like, we didn't do the respiration, but what we did do was the chest, you know. We did our best, you know, but I think that was the most difficult part in trying to be told you can't do something you're trained to do and seeing somebody pass away, you know. I think that also a lot of it, you know, as we were experimenting, trying to figure out what medication was best and what worked best, everything was so experimental at the time. Some things worked, some things made people, you know, worse. And another difficult part was being denied the ability to contact the families and have them see their families, at least on the tablet or something as such, because I just didn't find it fair. It was very difficult already for the families to know that they left their family members at the door and some of them never made it back out. You know, unfortunately, because everybody was so scared on, you know, being sued or anything because of how our patients looked, of the swelling and everything that it caused, the bruising, and it, you know, people did not look so well. So I'm assuming they did not want family members to see them like that as well. So I would say those are the 2 most difficult things.
Thank you for that. Tanya, I think Dr. Campbell.
Dr. Damali Campbell.
Excuse me. Thank you, Ms. Salazar, for your testimony. Could you elaborate a little bit more on Project Ready? You mentioned that in reference to diabetes.
Well, Project Ready is actually an organization, a nonprofit organization in Newark. We're opening up a pillar for health, public health. So I'm actually working hand in hand with them to try to see how we can help our community get healthier in this aspect, because diabetes was the #1 thing that I saw affecting our community and having most of the people pass away. Most of the people that passed away, I would say 90% had diabetes.
And was there anything, are there any specific suggestions that you have or gaps that you see in care for diabetics, the population that you were serving?
What I have turned to, and what this helped me turn to even more so, was non-invasive treatments that I've been studying and that I've been using with patients. And so slowly but surely, we're getting them healthier. We're helping them eat healthier. We're educating, of course, right? Because a lot of our community, from people from our communities, we just don't eat healthy. Let's just be, you know, honest with the pace of work and things like that. Unfortunately, we're not conscious of what we're putting in our system and how that's affecting us. So I believe that educating them first and foremost is most important, getting them to a state where they understand how they're being affected and how this is affecting them for the long run is going to be what's most helpful. I use frequency healing. I also use stem cell patches and things like that, I'm trying to take a more holistic and non-invasive way to help them and help them get off medications, period. Hopefully, that's my end goal.
Thank you.
Thank you.
Thank you. So before I call the next person, Jaleesa, thank you. We want to ask everyone, please place your name and organization in the chat. If you would like to speak, if you are calling in by phone, please dial *9 to submit yourself to the queue. We will call names in the order in which they were received. The next member from the task force who I believe wants to ask a question is Aaron Williams. Ms. Williams?
Thank you. Thank you, Ms. Salazar, for your service as a first responder and your service in the community as part of Project Ready. So I don't want to over question you about the circumstances around your firing, but I think it is important to just understand a little bit more, because I'm sure other people also experienced the allergy from the Johnson & Johnson vaccine. And I had not thought about, quite frankly, how that it was impacting people's ability to work or show up in their lives. So I just wondered if you could elaborate a little bit more on what led to your termination. Is it because you were allergic and you were out of work for 9 months? Is it because of your allergies you were concerned or did not want to get another vaccine, and as a result they fired you? I just want to understand those circumstances a bit more.
No problem. I definitely do not mind elaborating, Ms. Williams. Basically what occurred was when I initially took the vaccine, yes, we were trying to get it under control, but due to the fact that I was on 90 milligrams of steroids daily, my immune system was completely gone. I had none. And so my doctor pulled me out of the hospital because at that point I was susceptible to anything. Unfortunately, we did not expect to get the reaction under control in such a long period of time. We didn't expect it for it to take that long. The problem was that as soon as we tried to get me off some of the steroids or take me off some of the cetrizine, my body would react again tremendously. So the hives were continuous. And so the reason that they pulled me out of the hospital was due to the fact that I was left with no immunity. The reason I couldn't go back, and that they said they couldn't hold my position anymore. I refused to take another vaccine. I went through a lot with that one. So personally, I refuse to take another vaccine at this point. There's no way, after the reaction that I had, walking around with an EpiPen, being sent to the hospital 3 times, almost, passing away, like, no, thank you. So that's basically what that came down to.
Okay, that is very helpful. I'll yield. I'll stand back. Thank you so much.
No problem.
I'm sorry, did you mention who your employer was, or did you intentionally?
St. Michael's.
Thank you.
You're welcome.
Okay, I don't see that there's anybody else from the task force that has a question right now.
Can I just follow up very briefly? I'm sorry.
Oh,
would it be possible?
Is that Ms. Williams?
Again. It's Aaron.
Oh, sure, Ms. Williams, please.
I just wanted to know if we could I just wanted Ms. Salazar to know that I would like to make contact with her. On behalf of the Division on Civil Rights, I would like to make contact with her after this call.
Thank you. I would greatly appreciate that. Thank you, Ms. Williams.
So I'm looking, I don't see that any other members of the task force have a question. I'm just going to ask them one more time, only because there's a lot of people on the Zoom call. I want to make sure I didn't miss anybody. Is there anybody else from the task force that has a question? No. Okay. And I don't see that there's anybody else waiting to speak. speak?
Angela
Oh.
and Gonzalez. Just got it.
Oh, okay. I stand corrected. I understand Miss Angela M. Gonzalez is waiting to speak. Miss Gonzalez, if you can hear me,
Yes,
please.
yes, I can hear you.
Hello, Miss Gonzalez. Am I saying your name correctly?
Yes, you are. Yes, you are.
Very good. Well,
Thank-
welcome.
Thank you
Please.
so much. And thank you so much for taking my, my comment and open it to me. I was trying, and apologize for being a little bit late, but I guess I wasn't able to connect before. I was waiting for a while, but I am glad that I'm able to share my comments in reference to the impact of the community. I wanted to just do it because I have another meeting that I have to attend, but did not want to miss the opportunity or share how this impacts us here in Burlington County. When the pandemic hit, that they shut everything, it was so chaotic for our community in reference to not being no communication whatsoever for people that were trying to get ideas what's happening. I'm talking about, we have a large the Latino, and I have also a lot of Brazilian that live in Riverside that did not the communication, and I understand this was something new that we were not expected to happen, but it kind of gave us a tremendous awakening that we have to think that there are other people, even messages and things, even recording, because nothing was happening when people were trying to call. We were here in the human service. I think it was 1 or 2 agencies that were open. We never closed. I want you to know that.
Yeah, I took the train, so I'm gonna be walking the train station. I think I have a
Hello. Is someone speaking also as well?
You can keep going. Sorry.
Okay. Yeah, so some of the things we noticed was that, and I think it's probably preparedness in general, because we never know what anything else that could happen. We were, I know that there was a message that only those people that are a special rescue, or just, I can't even recall what was the title they were calling it. It was a special rescue or responder. I'm sorry, it's just can't remember what was called. That were only allowed to be out, but to us was the crisis that we're seeing of people calling the office and not being able to be available. We were first responder, and we consider ourselves first responder because you have a community that was desperately trying to find out what is happening, and communication, only what you heard on the recording of those departments were in English, and I understand English is the main language, but as a community full of immigrants that have also that want to find out what's going on and what's happening, it's very difficult when you don't speak the language, and all the messages and all the text and everything else that was happening was in English. And we were here, we just took, we only were out like maybe 2 or 3 days, but we worked and we were here at this building, taking precaution, of course, but the human cry that was out there of families calling that neighbor were not able to give them a ride to go to the supermarket. And since we live in a rural location, individuals were stuck in their homes without being able to go. They didn't have a car, were not able to go and get groceries, or didn't have any proximity to go and walk to the store. So those are things that I think that I would like to see it different, just in case anything else happen in the future, that we have to think about how to address those other communities to have even an immediate bilingual messages or to let people know what's happening. The second comment that I have is in reference to wanting to get people who got vaccinated or who did not get vaccinated, and it's all good. It's not also about the number of people that we reach. It's have to do that when we are providing assistance to find out individuals who has vaccinated or who has not, how many people we reach. It's not about getting you this number of people. It's also every single time we make a contact or work with an individual via phone, we have to provide case management for those individuals. So why is that? They are late with the rent. They have health appointment. They need health insurance. And by the time you make a phone call or try to work with this, you have to resolve issues for that particular client. And sometimes a call, it not be one, it's not in 10 minutes, or if the person does not speak the language, we call them and a library of issue open up for us. And we cannot just go ahead and hang up. I'm telling you, okay, we just wanted to know if you know. We also have to provide assistance for what is happening to them at the moment, resolve the issue. I just wanted to kind of bring that into the light, into the state, as certain things are requested of us. When we work with people that do not speak the language, it's not a simple 1, 2, 3 or what to do. It's a lot of work that take place, and due to the language barriers and cultural issues. And I just wanted to bring that as a comment, and that was it. Just thank you so much for allowing me the opportunity to share. The group that is doing the COVID work with us they are very great, but we know tremendously the barriers that are happening with the individuals. We work day to day with those families, and we know what's happening in their home. Wanted to bring problem with rent, problem with health, all those things, need medication, do not have money to buy the medication, all the different things. We just cannot just ignore them and just ask a simple survey or what it take more than that. I just wanted to make sure I share that. Thank you so much.
Thank you, Ms. Gonzalez. And please forgive me. I thought the name given to me was Angela M. Gonzalez, but I see it is Miss Angela Mateo Gonzalez.
Yeah, it's fine.
Okay, but I would like to properly recognize you and thank you. Before I turn over to the other task force members the opportunity to ask you a question, I would like to take the chair's prerogative and just ask you if you don't mind amplifying something you said. You mentioned in trying to reach the Latino, you actually didn't say Latino, but the community that is best served in Spanish, as well as in Portuguese and in other languages, using different medias and whatnot. Might you amplify on which types of media and how you have found best to reach these individuals? You may have said it, but I may have missed it. Please forgive me.
Well, some of those things that we did for the client was utilizing, since we have a mass text, we were able to let them know that we were here, that we were open. And we use a service of Textily to be able to, when we send a text, we are open, we are here. Our agency, we step outside to go and assist the people, even though the building was lack, we step outside. When I'm gonna be totally honest, when a crisis happen, an individual, they want to hear a human being. I don't know if we ever run out, and I understand that we cannot be from everyone, but in such a situation as we saw ourselves, I couldn't see myself closing this agency in a community that it was only us. Even people from the human service was calling us because we know we were the agency that was opening here. They were calling me to find out, do you know anything about my food stamp? Or do you know about my employment? And you see a crowd of people in front of the building looking at the windows, trying to figure out what do I do? How can I am sorry, there's some of those things it was like you calling, no answer. It was such a, I just, every time I think I couldn't find in my soul, stepping out of this and not being there for this individual. So we, besides sending a max text, which we have that service and we did it in Spanish and English, we are hoping we are open, you can call us. For those that had emergency, we saw them outside. We actually came outside, cover ourselves, but the desperation, people calling us, I don't have milk for my children, I'm hungry, we don't have food. We just went ahead and bought food and went and took it to their home. Stories that we have, I have stories that we wrote, all those different things for what we encounter. But leaving a message, or we're not here, leaving a message and people in recording, and it's just, and I understand, I don't want to blame, and I just think we have to look at different things when in the future for any tragedy or anything, that there are other people. And like I say, I don't know if they stop me, but I'm coming to help. I'm a first responder. I know first responder, we're the one that's supposed to be out. I consider myself a first responder because I have those family depending on us to answer them, to help them, to guide them, because they have zero communication with anyone or anything, what's going on in the state of New Jersey, what's going on nationally. It was, I'm sorry, I talk in my hand, I'm very passionate about my work. I just love my work. I love what we do for the people. This is more than just providing, doing service or what to do. This is something that we feel very strong from the heart. We love the work we do. And, like I say, we have quite a few. My assistant just left. We were just glad to be here. Just want you to know, very, very glad that we were here. And thank God we were protected and none of our staff got sick. They got sick at a different time, but I rotated my staff and we were able to be here functioning. We couldn't leave people out.
Thank you so much.
Thank you. Thank you very much. And I'm gonna apologize because I have to be somewhere at 6 and I hate that I have to leave. I love the conversation you have, and I thank you so much for putting this. This was needed. This was really needed. I really feel bad that I have to leave, but I have another meeting, have to be somewhere at 6.
We appreciate your comments. Sorry.
No, that's fine. We both got so excited. We both spoke at once. We told everybody else not to do that. Ms. Mateo Gonzalez, I want to thank you again. Might I ask, since you have to go to another meeting, if the task force members have questions, if they may call upon you to do so?
I'm always available for anybody that want to talk to me here.
Okay. Please provide us with your contact information and we will do so.
I will definitely going to go ahead and write it here in the chat before I leave.
Thank you.
Thank
Good
you.
night. Be well. To my colleagues on the task force, I apologize for taking the chair's prerogative and not realizing that Ms. Mateo Gonzalez had to leave at 6. Is there anybody else waiting to speak? I see.
Can you Mary Carl? Oh, no, I had a question for Ms. Gonzalez, but I know she's leaving, so we'll get in touch with her.
No,
later.
no, no. I'm not going that far. It's just, I just wanted to be on time, but I can answer. I'm sorry. Let me see if I can answer. Okay. I'm still on. I thought I was muted. Okay, I can go ahead. My apologies.
Thank you so much, Ms. Gonzalez, for everything that you did and really supporting the community. So with everything that you put in place, was there anything specific that worked really well that you think we can adopt for the next future pandemic or whatever crisis comes in place?
I think that probably having a bilingual recording in case something happened, or maybe because some of the individuals, I gotta say, they have computer issue, but I know that many of the Latino use WhatsApp. I don't know how will that be helpful to you, but at least in case of such an emergency that you guys can have a bilingual message that can probably give information or where to contact or what to do to inform people. It is horrible to be able to try to make a phone call and you hear the news on the TV, you hear everything, but if you're locally in here, you don't know where to go, what to do. And people call and they just like want to hear what's going on, what's happening, where do I go? And emergency is like something hit. I was just now that you mentioned that, I was just thinking, oh my goodness, if we were to be shot, what would happen to the family? Just like, well, even if they stop me, I'm sorry, but I'm a first responder. I am a first responder. We first responded to the Latino and the Brazilian community in here and other immigrants that also come to our agency, even though they don't speak very well other the Spanish or Portuguese. With a minor English, they know they could call because they know as immigrants that they feel comfortable calling. And so it was a good experience for us to know that we were available here. It was a call that I wouldn't change it for anything. And people were looking at us a little bit panicked. Oh, like, you guys are coming? Yes, we are coming. We are coming. Yeah, so but I think it should be is somewhat like at the Human Service Department or some of those things that people call, especially the area where food stamp, people waiting for their food stamp and all around what is going on, or a toll-free info in case of an emergency on the state. And then I guess if the state have something that is an emergency that everyone knows, just like the 211 or those that could provide bilingual information, and in each of your county where to contact and check with each of the county where are the minority organization, to provide their contact info. It's just, I know we were not expecting any of the situation that occurred. And we were not, I don't think anyone was prepared for this, but we need to think about that, because we never know an emergency in the state hospital things, and we have a sector of population. And New Jersey, I believe it is the 7th of largest in immigrant in here. And not having things in place is just as the service to a community in here.
Thank you.
You're welcome. Very welcome.
Note that information. Thank you.
Very welcome.
Okay. I'm going to call on, is that someone getting ready to speak? Sorry.
He wants to speak next. Rocio Perfil.
Mr. Rocio Perfil, can you hear me? Oh, I'm sorry. Mr. Rocio Perfil. This is Rocio Perfil Latino. Are you trying to say that you need interpretive services, or are you just saying, or is that your name? I'm sorry.
Hi. Yes. Hi. How are you? My name
Hi,
is.
how are you?
Thank you. My name is Rocio. I'm with Perfil Latino here in Cumberland, and just following the Latino community. Yeah, I'm remembering the first. We helped the Latino community do appointments for the vaccines, and I was remembering how hard it was when we sent them to the sites and there was no people who could help in the pharmacies or the hospitals with the Spanish translations. So they get frustrated because they had the appointment, but once they get there, they got returned at home because they couldn't understand. So I think that was a very hard issue. We used to even go with them to translate. So that's a thing that we can get better for next time.
Thank you. Was there anything else, Lucio, Ms. Lucio?
Not right now.
Okay, and forgive me, what happened is I had trouble reading the screen, and so you're with Perfil Latino, is that correct?
Yes, from Cumberland.
From Cumberland, okay.
Thank
Thank
you.
you, thank you for your patience, thank you for all you've done.
Thank you, and thank you for giving us this experience in this meeting.
I don't know if anybody else has questions. Oh, I'm so sorry. Oh, Ms. Williams, please go ahead and ask your question.
Thank you. Miss, I believe, Rocio Perfil, when you mentioned that people would go to, I think, pharmacies and other medical facilities, and they were not receiving, they were not provided with any types of interpretation or translation services. Do you know what would happen after that? Were they voluntarily leaving? Were they at any times instructed to leave? I just want to follow up and understand what happened once they were not able to receive the services.
Yes, it was, they were returning because they couldn't, and they calling us back that if we could help with the translation in the pharmacies because there was nobody speaking in Spanish for them.
So if I understand correctly, you would be contacted by the community member to come with them back to the place so that you could translate. Okay.
Yeah.
But do you know if they were voluntarily, when they went up to the pharmacy, for example, and they were trying to be provided with any level of services, were they just leaving or were people turning them away? And I know that may sound like a small difference, but it can be important to know if people were just saying, okay, I'll come back with somebody, or if maybe someone who worked there said you need to leave because we don't have anyone.
We have both experiences.
Okay, can you elaborate a bit more about what your understanding is of those experiences with a particular focus on the times where people may have been turned away by someone at the facilities? And a second to that, if there were any trends, and by that I mean, did you see maybe particular types of facilities doing that, whether it be specific name brands or companies, or even like pharmacies or testing centers more than other places?
Yes, some were voluntarily, and the others was, for example, CVS, who said we can't help you, and also because they didn't have a social security number. So they were refusing the vaccines for that. So we start talking about that, and then I guess they hire Spanish speaking people. Now we see more Spanish people in our pharmacies.
I'm sorry, you went out a little bit on the end of that. You said that you see more now. As a result, you see more Spanish speaking people doing what? I'm sorry. Oh, did we lose her? Maybe we lost her.
I think you may have lost her.
Yeah. Okay. We'll follow.
If we lost her and she comes back on, we'll certainly allow her to speak and answer your question.
Okay. Thank you.
Oh, you're welcome. Okay. All righty. So the next person we have is Miss Thelma.
Oh, is it just to you? Okay,
Is that? So sorry. What just happened?
Sorry about that.
We're good? Okay. I believe the next person we have is Miss Thelma Carrera. Miss Thelma Carrera. Can you hear me?
Yes, can everyone hear me?
Yes, am I saying your name correctly?
Yes, you are.
Good, welcome, Miss Carrera.
Thank you. I am here not on behalf of the Division on Civil Rights, but I do work for the Division on Civil Rights. I am here on behalf of the Guatemalan Civic Association of Mercer County. I just wanted to provide a brief. Sorry?
Go ahead, Ms. Carrera, please.
Okay, I just wanted to provide a brief summary of the Guatemalan Civic Association's work in Mercer County, specifically Trenton, during the pandemic, and which still continues. The pandemic is not over. So we, as the Guatemalan Civic Association, we would respond to families saying they don't have groceries at home and they're scared to go to the grocery store. This was right in March, April, May, until June, until there was more information on using PPE, being able to go to the grocery store, etc. So we would respond by providing families groceries. Once the vaccine rollout happened, we also worked to schedule appointments for families. We also we also crowdfunded within an already limited community to pay hospital bills for undocumented families. I want to point out that the Guatemalan Civic Association of Mercer County is not a 501c3. And because of that, we were not able to apply for funding. So all of these efforts came from members' pockets and the crowdfunding that we were able to do within Mercer County. I wanted to point that out because there are currently about 50,000 501c3s in New Jersey. And all of these organizations have their own stakeholders, their own clients, their own members of the community that trust them. So in instances like the COVID-19 pandemic that is very much so going on, the state of New Jersey had and still has a very unique opportunity to leverage the relationships that these organizations already have with the community members of New Jersey, leverage the state resources and funnel these resources to these organizations. I want to go back to the point that the Guatemalan Civic Association is not a 501c3. I know that a 501c3 status is a federal status granted by the IRS, so that's not in the state's hands. But I do want to highlight that future programs for funding should focus on organizations that do the work and not necessarily organizations with $1 million budgets with 30 plus staff members. It should really focus on organizations, 501c3s or not, that are doing the work and have the trust of the community. The Guatemalan Civic Association of Mercer County has been around for more than 15 years. I have been involved with the Guatemalan Civic Association for about 15 years as well. And this organization has done and continues to do amazing work. So I think one recommendation or one highlight is that the state of New Jersey, whichever division or department would be funding or providing funding to these organizations, so should really leverage the trust that these organizations already have in the community. Thank you.
Thank you very much, Ms. Carrera. I just want to see if any of the members of the task force have any questions. I think I see Kaya, Ms. Kaya King. Do you have your hand up?
Yes, thank you so much.
Thank you.
Ms. Carrera, thank you so much for this testimony. It's very illuminating. I think also just hearing that you're speaking from a different space when we think of trusted voices in the community. I think I can echo the sentiments of the other task force members where we've been hearing that ongoing theme about really investing and supporting these types of organizations. To your comment about, being more mindful of ensuring that federal dollars, state dollars are considered for an organization like yourself. is it also something where we need to consider recommendations to potentially expand the concept of essential personnel? I know we've heard testimony about the gap of translation services, and I also wanted to hear what your thoughts were about making sure that an organization such as yours is also considered to be essential, so they're able to move a bit differently as well during the pandemic.
Thank you for that question. I definitely agree that that we should, whether in law and writing or really just in the spaces that we occupy, see these organizations as essential components of communities. And if I'm understanding your question correctly, Ms. King, it is by recognizing that these organizations are essential parts of the state, of communities that are impacted, then by naming these organizations essential, then there will be a path or at least an argument to be made that the state should be pouring funding into these organizations, that the state should be leveraging and partnering with these organizations as these organizations know their community members the best. I know that the state has the best intentions. I work for the Division on Civil Rights. I know that we have, community members at the front of our work. But we have to be mindful that organizations who interface with community members every single day are on the ground, know these communities the best. So I think that I definitely agree that if we do name these organizations and the work that they're doing as essential, then that opens a door for funding, for recognition, for partnership with the state.
Thank you so much.
Hold on a minute. Oh, okay, I believe Ms. Erin Williams has her hand up.
I know, I'm back with another question. Thelma, can you advise or can you tell us what you think, better yet, what was the Guatemalan Civic Association's budget for the year? Was it only set by crowdfunding? And if so, how has that fluctuated at its lowest and at its largest?
So because the organization is not a 501c3, is not eligible to apply for funding at the state or federal or local levels, with the exception of some foundations, private foundations that will provide grants to non-501c3s. We don't have a budget. The organization is volunteer run entirely. Even the e-board is volunteer run and has been for the 15 plus years that it's been around. So what we have been able to do since March of 2019 or 2020 is crowdfund internally within the membership of the organization, and then crowdfund to the larger community of Mercer County. This has included setting up GoFundMes, doing Facebook Live events where we get to interface with our 5,000 plus followers and say, we have 20 families who need groceries in the next 4 days. You can Venmo us here, you can donate on GoFundMe here. So all of the operations that and all the things that we've done in the community have all been funded by crowdfunding. And I believe that we don't really keep record of year by year the amount of money that we have or that we have expended on services, just because of the touch and go way that we have to do our work, because folks needing groceries is not something that we have the time to sit and think about or write down in bookkeeping. But I would say that donations through crowdfunding have been higher because since the beginning of the pandemic, because folks are seeing the need to help organizations that are directly in communities.
Okay, thank you. That's really helpful. And I have two quick questions. I think you referenced other resources. Can you advise as to what other types of resources, maybe beyond money, would be helpful to look at organizations like yours? And then second to that is, you mentioned obviously that the organization is not a 501c3, and I just wonder if there are barriers to achieving that status. And if not, you don't have to necessarily describe that.
Sure. So to your first question, one of the resources aside from financial resources is is connected to your second question, which is the state providing resources to organizations such as the Guatemalan Civic Association of Mercer County to gain 501c3 status. Like I mentioned earlier, I understand that 501c3 status is something granted by the IRS, so that is a federal agency. But I think the state has the unique opportunity to provide programming or provide training or provide resources on how these organizations can gain that status. Also, something that wouldn't require funding but would require state employee time, which I I guess is funding, would be for divisions or departments within the state government to have to collect information from organizations that are in communities, and saying, you know, the Guatemalan Civic Association can be housed under family resources. So basically having like a website that lists organizations, whether 501c3 or not, that offer services with a small, I guess, bio or something like that of the services provided. I know that there are state websites that do have this information available for different areas of services within different divisions and departments. But it would be great if the state could have a website or a page like this that is linked directly to every single division or department's resources on COVID-19. Folks, you know, there are 50,000 plus nonprofits in the state, and I'm sure more than half of them have provided services through the pandemic and related to the pandemic. So I think that the state has that unique opportunity to leverage the work that these organizations are already doing without necessarily reinventing the wheel, and recognition for that, not in a press release, not in a press conference, none of that, just having organizations listed as a resource for New Jerseyans. And then to your second question about 501c3 status, although the association has been around for 15 plus years and has had an executive board for all 15 plus years, has held various events in the community for 15 plus years, and does collaborate with different organizations in Mercer County, it is very difficult for an organization whose members only speak Spanish to really understand the intricacies that the IRS of the requirements that the IRS has for 501c3 status. So even though I speak English and Spanish, I am the only fluent English speaker in the association. And I have a job, I have responsibility, so I'm not able to personally take on that huge endeavor of applying for 501c3 status. So definitely the lack of language access is one of the reasons why we are not a 501c3 organization.
Thank you so much.
Dr. Jamali Campbell.
Thank you so much, Ms. Carrera. I wanted to ask you, with your organization of 5,000 followers, so, just thinking about some of the work that you did Is it feasible to think about using this organization, the Guatemalan Civic Association in Mercer County, as a vehicle for communications? And I'm thinking specifically about, we went through one hurdle of giving people information about the vaccine, and now we're in the hurdle of people having COVID and getting sick and not being aware of that there's medicine available or how to access medicine. And so I wonder if you believe that your organization could help with that, and if that would be feasible.
Thank you for your question. So it is feasible, and it is something that we have been doing since March of 2020. We hold many Facebook Live events where we have an attorney providing legal guidance for folks who are undocumented and want to undergo the immigration process to have documentation. When the stimulus checks were being talked about, and once they were sent out to folks, we had to hold a Facebook Live event explaining who is eligible, how much are you eligible for, and explaining that undocumented folks, who are the majority of our followers, were not eligible for stimulus checks. Excuse me. We also we just do a lot of Facebook Live events explaining certain state laws or certain state or federal programs that folks may or may not be eligible for. That includes, we've had Facebook Live events describing using CDC information. Obviously, none of us are doctors. We're not going to provide medical advice. But using CDC information and the information provided by different organizations, we would talk about the vaccines available when they were first rolling out, the different places that someone can get vaccinated. We would also hold live events of where to get tested. I live in Trenton, and the Cure Arena here in Trenton is a huge resource and is still a hub to get tested. So it is definitely in the realm of our capacity, and it is something that we have been doing. At this point, our Facebook Lives are more focused on immigration status and paying for hospital bills associated with COVID-19, which undocumented people are not eligible for Medicaid or Medicare. So that has been another big hurdle that we have seen in the community. So those have been some of the topics that we have presented on, but that's definitely something that we have had capacity to do.
Are you aware about like folks who may be doing tests at home, or what might be barriers to getting tested, or like letting people know if they did test at home? Are there specific barriers that this committee could elevate?
Yes, thank you for that. One of the barriers is being able to find these at-home tests, which was more of an issue at first when at-home tests were being rolled out, right? People were buying them up, were hoarding them, leaving very little to none for other families. And although the federal government did send out some tests to specific families, one thing that we saw at the association was that there was a limit on the tests sent per household, per address. And within the undocumented community specifically, there are multiple families living at one address at a time, whether it's a duplex, whether it's folks renting out one room at a time. There are a lot of instances where families strangers have multiple roommates, housemates. So although the federal government provided these free at-home tests, we ran into the issue where, you know, they sent 4 tests per household per address, and then there were, you know, 10, 12 different people living at that address who may or may not be family members, who may or may not be friends. So that's still a barrier that we're seeing. CVS now, for example, has at-home tests that are free, but the central CVS in Trenton, it's on Greenwood Avenue in Trenton, New Jersey. That one has barely or rarely has tests available. Whether that's because it's in a low-income urban city, whether that's because folks are, you know, going every single morning when they restock and taking them, whatever it might be, there are just not enough resources for folks to adequately get tested. That's at-home testing, and then getting tested at a hospital, at a doctor's office, or at a CVS, a Walgreens, or any other chain pharmacy like that. At first, there were pharmacies that were price gauging, who were charging $75, $100 for a test. Undocumented people, since they don't have health insurance for the most part, whether state, federal, or private health insurance, they would have to pay $100. They would have to pay $75, $125 for these tests. And we were running into an issue where these families who have multiple members in their household, if someone is symptomatic, we can assume, or it has been assumed, that everyone in that household who has shared bathrooms, who has shared food, are all sick. So that would mean one person would have to pay $100 for their test, someone else would have to pay $100 for their test. And it's just harder when there are, it's a single mother and she has 4 kids, or it's a family of 8 who are newly arrived in the United States and don't have that financial stability to be able to pay for these tests. So definitely something we're seeing still is that it's difficult to get tested. And then that affects being able to go to work, because if you're sick, if you have symptoms, you can't go to work. A lot of employers are at this point, at least this is what we've seen in Trenton, some employers, specifically for those who work, we call it under the table or earn cash and are not officially on the books because they're undocumented. They have bosses and employers who make them go into work if they don't have a positive or negative test. And since there is trouble having access to testing, then this isn't possible, and folks miss days of work, which in turn affects people's housing, affects people's access to food, et cetera, et cetera. So that's a barrier. And then also some organizations who do provide testing, such as the Henry J. Austin Center here in Trenton, or Trenton Health Team in Trenton, or et cetera, all of these organizations, sometimes they also don't have the capacity to translate this information to Spanish or different languages, because undocumented immigrants are from other countries, not just Latin America, and speak different languages. So it's just a big pot of issues that feed into each other and exacerbate the conditions that folks are living in.
Thank you so much.
Thank you, Dr. Campbell. Thank you, Ms. Carrera. The next person we have, and I hope she's still here, and I want to thank her for being so patient, is Ms. Ethel Mobley. Ms. Mobley, are you still on the line? Ms. Mobley?
Yes, here.
Oh, I'm so glad, Ms. Mobley. My apologies for keeping you waiting. First of all, am I saying your name correctly?
You certainly are. Thank you.
Oh, good, Ms. Mobley, please, the floor is yours. Please feel free to speak.
Okay, I'm just a resident of the state, and I am a member of a community center called Oceanside Family Success Center 2. It's in the neighborhood of Chelsea. I am an Atlantic County resident in the city of Atlantic City. And I was invited to come to this hearing through a conference that I attended recently. So I decided that I would sit in on it, and I also invited friends. I want to first off just say I am proud of the manner in which our state has handled this entire situation, the pandemic, because I was one that actually listened to the meetings that Governor Murphy held on a regular basis, just for informational purposes and knowing what to do next. At that particular time, I also represented my neighborhood in a not-for-profit organization called Eastern Service Workers Association. And we provided help for them, food deliveries, for example, during the pandemic. So I was instrumental in the planning of that and seeing that the deliveries got to where they were supposed to. But my reason for speaking is I wanted to give you just my experience, because I had been exposed to COVID, and I'd also been vaccinated at the center that was set up at our conference center as soon as I can. And, you know, the information that I said earlier, put out by the governor, gave like an order in which to go and get your vaccinations. I am a mild risk, so I went to get my vaccination during the time of those who had mild risk. And in so doing, I believe that the exposure that I had when I was informed of it, because I did not even know that, I had no effects, no serious effects. I believe that is due to the fact that I had the vaccination. So we're talking about our experiences and how they're affecting certain marginalization and demographics. And I just want to point out the fact that there was supposed to be contract tracing to help determine the source and also whom you may have potentially infected. And I had no contract tracer contact me. So I would, and then I was exposed more than once. In that first exposure, I was exposed at a dental office. They told me that the person that was exposed was, of course, not working, or that carried was not working, but all of the other employees within the office had been tested and were back to work within a couple of days. I was informed a day after I was exposed, but by that time it had already been a week. Not knowing what I should do, because I was not a healthcare professional, I began making calls and trying to find out, oh, what's the next step? And finally, I called New Jersey 211. New Jersey 211 gave me all the information I needed. And of course, I complied with that. However, there was uncertainty there. I did not have a test to take. I was given places where I could go and get a test. However, as someone just mentioned, that $100 was not something that I could afford to pay to take a test. So I did not have a test. I waited the time that was recommended until getting back out and doing my normal routine. There was something that was sent or publicized where we could get the rapid test mailed to us. I think that was also mentioned. So I did have rapid tests mailed to me, and they came to me this year, I'll say early summer, where I was exposed the prior year. So the test came, I'll say within a year after I requested them, but they are now expired. And one question I have is the expiration date an actual expiration date on these rapid tests? How long can we use them for our testing? And can they be exchanged for a good test that might not be expired? I recently gave a test away to a friend of mine. I don't know if she's still here on the call, but she had symptoms of COVID, and the test that I gave her confirmed that she had COVID. Whether or not she had went to the website as I did and said, I've been exposed, and had a contact tracer contact her, I don't know. But I think this is something that maybe what we ought to think about for future. We never knew we were going to have all these variants, so we don't know how long we'll be dealing with this. But I think it's important for us to know how we should proceed when we're exposed, and be clear on it. Because as I said, I listened to the information that was put out to the public. I also went to the website that New Jersey set up, and it was not clear to me what I should do with that exposure. In my risk group, it said one thing, but then it also said another thing, wear your mask and go out. So I think we need to have clarity also on what to do, when, and definitely affordable tests for everyone. Thank you very much.
Thank you very much, Ms. Mobley. First of all, I want to say I really appreciate your calling in and waiting. And your individual friends who've also called in, they have the opportunity for 3 minutes or more if they like, even if they're at your same location. I just want to say that. I also want to say thank you for your getting the message out there to so many people. My colleague and co-chair, Ms. Marilyn Centrone, is going to answer a lot of the questions that you just asked about the task, and then we will open up to the rest of the task force members, if that's okay with you, after she's done responding to your questions. She may need you to repeat some of them again, but I'm going to turn it over to Ms. Centrone.
Hi, thank you for your testimony. As far as expiration dates, a lot of the COVID test expiration dates have been extended. So if you look at your box and you look at the manufacturer, you could go online and it'll tell you. Some of them, I know the Bionex Now has been extended, as well as I think the ones they were sending out was in a yellow box. I'm trying to remember the name of it. But if you could put in the chat the name of your test, I could look it up for you, or you would be able to look it up on Google actually, and it'll give you a new expiration date. In terms of the contact tracing, I wanted to ask if you never were actually tested for it to be positive, that's possibly why you weren't contacted. I'm not saying that that's the only reason, but when you said you were exposed, it was the dentist's office that called you that said that potentially you were exposed to someone that was positive?
That's correct.
Okay. But that is a very good point in terms of those are a lot of missed opportunities that we need to look at in the future. So that even if you don't have an actual positive test because of the scarcity or the inability for people to get tested, that we should communicate better from that perspective. So thank you again.
I think Ms. Synthron, she was also asking about ordering additional tests. Do you want me to? Okay, so Ms. Mobley, you certainly can get, I don't know about exchanging the tests. I don't think you actually exchange them, but certainly every month you can get additional tests. And we actually have a wonderful website. I don't know if you want to go there, the New Jersey COVID-19 website, which we'll post in the chat box right now, but also, as was mentioned earlier, you can also go to not just CVS, but to other pharmacies as well. And I'm not asking you to publicly tell us if you have insurance or not, but depending on your insurance, you can also get so many free tests per month, as well as are still providing some free testing services. And you mentioned you were in Atlantic City, I believe. Did I hear that correctly?
That is correct.
Okay, and so before we hopefully within the next few minutes, we can post the website for where you can, the New Jersey Department of Health COVID-19 website, in terms of your being able to access where you can go to get the free test kits as well as get free testing. And I think those were all of your questions. I hope so. If not,
I still have one other, because with my experience, I had those telehealth doctor visits, and the doctor mentioned, let us know if you get COVID or if anything happens. And of course, when I contacted the office, no one answered the phone, no live person. So what Ms. Gonzalez mentioned earlier, no one wants to hear automated voice. We would like to hear a live person. And when we leave a message, we would like a response to that message. And that never happened for me. And I guess it's due because when I finally got into the office live, the doctor told me they did not get that message. So they never had the opportunity to respond. My question is, why weren't the doctor's offices able to test us?
That's you mean, why weren't all of you're talking about your private physician, Ms. Mobley?
Yes, yes.
Yeah, that's a very, very good question. And one of the issues regarding the availability of tests, and I'm glad you brought that up, where we're trying to increase where people can get tested at different doctors' offices, but your point is well taken, that most of the testing and testing sites are either pharmacies, federally qualified health centers that you heard or earlier, and or other types of sites like that. So that is a point well taken, that we will incorporate into the recommendations to have more availability of testing at private or small group practice doctors' offices. I would like to turn over to the rest of the task force members to see if they have any questions to ask you, Ms. Mobley. Is that okay?
That's fine.
Thank you so much, Ms. Mobley.
You're welcome.
I see Ms. Ashia Hayes, I believe, has her hands out. Ms. Hayes, please, the floor is yours.
Thank you, Dr. Raggio. Good evening, Obi. Thank you so much for your testimony today. I did want to ask you about contact tracing. I know you said that you had COVID twice and no one reached out to you. I've heard similar stories from someone who had COVID twice, once in 2021 and once in 2020, and no one reached out to them in 2021, but someone did reach out to them this year. Excuse me, I said 2020, but 2022. So I was under the impression that it was getting better. So my question is, how long ago did you have COVID and no one reached out to you?
That first exposure was in 2020. And the last one was this year.
Okay. Can you share the month if you don't mind? of this year?
This year, oh boy, I want to say March.
Okay.
Well, in March, I don't believe I went to the website and said I was exposed. I did back in August, September of 2020.
Okay, thank you.
You're welcome. I
Oh,
may be
okay.
off a year. I may be off a year with that. I'm sorry. Because I know we were on lockdown for that first year. So it may actually be August of 2021, when I was able to get back into my medical appointments and whatnot.
Thank you.
You're welcome.
Is there anybody else from the task force that has a question for Ms. Ethel Hill Mobley? And Ms. Mobley, I have to apologize to you too. I didn't see the Hill earlier. I see it's Ethel Hill Mobley. I
that's fine.
apologize. Thank you, thank you. Did we also answer all of your questions? I want to make sure that we were attentive to.
You did, and I just want to, hindsight is 2020, and we're doing so well now where we can have tests mailed to us. But early on, even though we had that center set up here in Atlantic City, and I realized, we're not near New York, North Jersey, the hotspot area. But even it would have been good if we could have had vaccinations at our doctor's offices. I don't know if there's a law regarding that or not, just what they can administer, but
That's definitely something that has been brought up, so that it is about expanding that access. It was a matter of who was already in the system to get the vaccines out quickly, but it definitely needed to roll out a little more extensively than that. Thank you for that comment, because it's been brought up before and it'll be part of our report.
Yes, and I'm part, in the other hat that I wear, I happen to be a pediatrician as well as preventative medicine is my specialty, are my specialties. And in the New Jersey Immunization Task Force, and I'm not speaking for them, but in that, not task force, New Jersey Immunization Network, please forgive me. We've had extensive discussions about that, because New Jersey, as you have stated quite well, unlike a lot of other states, we still have a lot of small group practices, private physicians, particularly where minorities tend to go, where people from the communities where we're trying to reach tend to go. There is, in answer to your question, there is no law that says that we as small group of private physicians can't vaccinate. We certainly can vaccinate but in accordance to our licensure. But what happened was initially trying to get the vaccines out very quickly. A decision was made, and as you said, hindsight is whatever, but a decision was made to get the vaccines and the tests out to pharmacies, out to federally qualified health centers, certainly departments of health, New Jersey, and then our smaller departments of health, many of our hospitals, they're outpatient facilities. So what you have brought up is quite important and well taken. Certainly several members of the task force who are physicians in private practice have also brought up this issue. So I thank you, Ms. Mobley. Excellent point. All righty, so I don't see anybody else who has their hand up to ask you any additional questions, Ms. Mobley. I don't know if there's anybody else waiting. I want to thank you again. If you did want to say anything else, there's no one else waiting, you may. No, we're good? Okay, thank you.
I was just jotting down that website I saw come up.
Oh, okay, go for it. I'll tell you, it's a great website, Ms. Mobley. I use it almost every single day. It has information on where to get your tests that you were asking about. There are telephone numbers that can be called that I was going to mention later on. Actually, we can put those also up on the website. And when you call, first of all, people answer in many different languages. I mean, we have 4 different interpreters in 4 different languages right now. But I believe, and I'm looking at my colleagues from the Department of Health, I think when you call the numbers on the website, either for testing or vaccinations or just medical information, I think they have 13 different translators immediately available, as well as I believe a language line for additional languages. But I'll defer to my colleagues at the New Jersey Department of Health to verify that. I don't know if they want, or if they want to say anything else about that. No? Okay. All right, they don't. I see Ms. Salazar, you have your hand up, but there's oh, I'm sorry. Forgive me, Ms. Salazar. I need to go to someone else first. April, do you have your hand up? Can you hear me, Ms. April?
Yes, hi. Good evening, everyone. I have my hand raised. How are you?
We're good.
Good, thank you. Can you hear me?
Your name, because it's the month of the year.
I too was I had COVID back in 2020 when it first happened, and it was really, really bad. The first 2 weeks. I also had it again. I think this is 22. I think it was 21. The second time it wasn't as severe. Fully vaccinated. One of the things that I wanted to touch bases on and try to get some information or just point out, we still having a lot of people that's being tested positive for COVID now. And the rule is you stay out for 5 days and then you return to work or to your normal duties or whatever the case may be, as long as you test negative. I think that it's such at a rampant pace right now that some of the rules, I think they got lax in, that they need to probably put more time on, because it seems like everybody is getting COVID now. No matter where you go, where you turn, somebody is testing positive for COVID. Also, I know that some of the people, and I experienced this personally throughout my job, or family and friends. And certain communities, there are doctors that are giving medication to people that are coming up positive. And there are some doctors that are not prescribing their patient any type of medication or anything like that. Is that something that we need to address? Far as, is it a community where you live? Or, because that's not, to me, I don't think that's good practice, put it that way. So that some get and some doesn't. Also, I have a lot of stuff. With the testing that Ms. Mobley was talking about, the testing for the at-home testing, there are you should contact your doctor when you are tested positive for COVID, if you test at home. So this way your doctor know. So he can also have you come in the office, because most doctors will tell you to come in the office and they will test you again to make sure. That's a way of doing the contact tracing. I know that each time that I was tested and I came up positive, I was contacted at the very beginning in 2020, and I was contacted again. So I think that's what needs to be done. You have to report it to your doctor, and you also have to either go to your doctor. Also, most of the facilities are not reporting it. And that's another problem. If your doctor is not reporting it to, I guess, the would that be the CDC, whoever they're supposed to report it to, or Department of Health, if they're not reporting or giving those results to them, that's why most of the people are not being contacted for contact tracing. If you on your phone and you go into different areas or go over to the city or wherever you go, your iPhone or your Android phone, it'll tell you that and that's if you register. Excuse me, I'm all over the place, but you also have to register on the website. And if you register, it'll pop up on your phone and tell you that, you're in a certain percentage or you're around somebody that has a positive or may have been positive for COVID or something like that. The app will come up on your phone, a message through the text. What else? I just was writing down notes. I think that's it.
Thank you, Ms. April. We really appreciate your comments. I'm going to, if it's okay with you, I'm going to turn it over to my colleagues who may have some additional questions. Is that okay with you?
Sure.
Thank you again, Ms. April, for your comments. And and I just wanted to mention you for everybody, so reinforce what you said before the task force members ask questions. What Ms. April is talking about, and I actually have it on my phone, is if you go to the task force, if you go to the New Jersey COVID-19 website, what you'll find is that you can register your phone, and you'll be told, and I don't know how, I'm not a techie, I don't know how it does this, but if you're around someone else who's registered and they've been positive, it'll let you know on your phone, and you can go ahead and be tested. It actually happened to me several times, and I got tested and followed up. It's been very useful. So I want to encourage people that's another wonderful resource. So I see multiple hands up to, I'm sorry.
These are all for testimony.
Oh, okay, please forgive me. One moment, Ms. April. Is there anybody from the task force that has questions for Ms. April before I go to the next person? Okay, well, Ms. April, thank you again. I wish you and your family well. You mentioned that you had COVID-19 several times. I wish you well. Okay, Ms. Salazar? Oh, Ms. Salazar, you had your hand up?
Yes, I just wanted to bring attention to one more thing that definitely rose during the pandemic. And this is due to my other business and that I know of. I'm an advocate against domestic violence and abuse. And I must definitely say that the rise of domestic violence and child abuse was tremendous. The rise of suicide was tremendous. And definitely, so many things were closed off and so many people were prevented from being able to get help due to this during this time. So what solutions can we find and is at play, during a time of crisis like this?
Those are excellent points. And it is something that I know we certainly are incorporating into the task force recommendations. And I know others are also working on this. And there are sites, I don't have them in front of me right now, but perhaps before we finish, we can post them where persons, and I say persons because women
and
men and persons, however they identify, and children are subject to violence, domestic and otherwise. So thank you very much, Ms. Salazar. We have two people next. Let me see who's first. Keisha, Ms. Keisha Coleman, can you hear me?
Yes, good evening, everyone. I wanted to thank everyone for sharing. I just wanted to particularly follow up, piggybacking on Ms. Mosley and April regarding the contact tracing. I too had a similar experience with LabCorp because I am a person who has several autoimmune diseases, and I have to do a lot of blood work, pretty much monthly. And I didn't get any contact tracing at all when I was notified by LabCorp that I had been exposed. And then when I read the notice that LabCorp provided me, it was almost four days time had lapsed between when I guess I got the letter and the exposure. So I had already been at work, and doing what I normally do and going about my day. And yes, I was, wearing my mask and taking my normal precautions, but I did notice that I didn't get any contact tracing, and that there was a gap, a huge gap in that time frame of notifying me about the potential exposure. And I did find, though, my colleagues at work who did utilize the app as far as letting them know if they had been exposed or were in areas with COVID exposure. That was usually the people who got the contact. They received contact tracing to let them know that they were exposed or that they were going into areas, but not everyone has the capability of having an app on their phone where they can get those types of notifications. So, I mean, it was good to have, but it wasn't widely available to everyone. And a lot of people just didn't know. And the other issue that I noticed that I had was, I don't know if most of you probably do know about NJ Docket. I went on to that app to use it because everywhere I went, it seemed like I needed to let someone know what my vaccination status was, including for my employer. But what I found was my information was not somehow, I guess, being transferred or uploaded into that system as I assumed that it would. So when the first shot came out, I used the app. I noticed that Docket had the information in there, but as I continued to get the series of shots, as I became eligible for them, I noticed that NJ Docket didn't have it. And it took me maybe a month or so to figure out how to get a hold of someone at NJ Docket or at DOH to help me figure out why my immunization record was not being reported or transferred over into that particular system, during that time period. So I think that that's something that people should have some information out there about how to go about getting their information in. And I did get a hold of someone at DOH who turned me on to NJIISSUP, I guess is which is the support system. And basically I had to give them all of my immunization records and my driver's license and social security number to get that over. And I found what happened was because my name is hyphenated and because I have multiple insurances, that was one of the reasons why that system could not keep up with or figure out how to input the information, though it was being transmitted onto NJ Docket. So I just wanted to share that.
Ms. Coleman, thank you so much. You shared a lot of wonderful information. We're very appreciative. Ms. Centrone wants to say something?
Ms. Coleman, thank you for your testimony. I have a quick question. Ms. Mobley is located in Atlantic County. Would you mind sharing what county you're located in?
I am in Burlington County.
Thank you for that. And then I was going to comment on the New Jersey docket. We found, I'm a part of a federally qualified health center. And sometimes when people come and somebody had entered their information, usually with hyphenated names, if they spelled it wrong, or if they put your cell phone where your home phone is supposed to be, it makes it difficult. So definitely, I'm glad you brought up the docket app, because there could be ways of just easier verification, because the only way to fix it is through the Department of Health.
Right. And I thought it would be driven more off of the social, because the social follows you with the insurance and everything. So it just became very challenging because, as I said, everywhere I went and everything I did, I always had to present what my status was and proof of that, and trying to keep up with all of those different cards. And especially when I had to use multiple different insurances to cover it, even though I was told that these vaccinations were free, they really weren't free, because if you had insurance, I can tell you my insurance was billed every single time, and I've had 5 vaccinations. So it just became challenging. And then when I found out my grandkids had the same issue when we tried to use NJ Docket where they weren't on, and part of that reason was because of the use of multiple different insurances as they were getting the series of shots. It was just very hard when you have 3 or 4 kids where you have to track all of these different little cards for the vaccination, especially when you were getting, say, one vaccination at ShopRite, one vaccination at CVS, one vaccination at Walgreens. And even though you're trying to bring your cards with you, it just became very difficult. And then some vaccination sites would question the card, and, because kids are carrying them around, they get soiled, they get, sometimes illegible. I just noticed that was something that there should have been, or I thought there would have been more information out there about how to go about it to have one place where this could be tracked easily, and something that people could have to give to employers, where that information you could rely on it being there when you needed it.
Agreed, 100%. Thank you for that.
I don't see any other task force members with their hands up. I again want to thank you, Ms. Coleman, for the very valuable information you shared with us. And I wish you and your family well. Ms. Cynthia Blue, can you hear me? Do you have your hand up? Do you hear me?
Yes, good evening.
Good evening, Ms. Blue. How are you today?
I'm good, in yourself?
I'm good. I'm not going to ask you if I'm pronouncing your name correctly, because I know it's like the color blue, right?
Just like the color blue, yes.
Okay.
My comments are twofold, and one which others before me have spoken on is the contact tracing. That is so vitally important. I work with an organization where most of the members, 98% of the members, are first responders in law enforcement, fire, and sheriff's, police, various departments, and including the corrections police officers. And it's disturbing that when you're working with someone and you are meeting, and then you get a phone call a day or two later that they tested positive for COVID and no one is saying anything. That's a problem, because these first responders, and I'm specifically speaking of them, they're taking this home and exposing their families. And I understand they have to work, and they're earning their living, they're doing their jobs, they're taking care of their families. But if they're exposed, and I know we can't control the exposures, but we certainly should be able to control being able to contact people within a timely manner. So that is vitally important. And especially when you have some officers who have had COVID 2 and 3 times. I know of a particular one who's been out of work a year already. And this is an individual that is a young person, under 30, appears very healthy, physically fit, who hasn't been able to go back to work because after the 3rd exposure, he's still out on disability. And the other thing that I think we need to look at improvement on is our communications. because we service a area in the city of, and that is economically challenged. And to see the people in the beginning, I don't know if it was a matter that they didn't believe there was a such thing as COVID, having to fight, or not necessarily fight, but really struggle with getting people to understand that there is a health crisis and that they need to be tested, you know, or they could be exposed and they could be carrying and exposing other people. The communication within a community needs to be much more aggressive, especially in economically challenged areas. It needs to be very aggressive.
Thank you, Ms. Blue. I didn't know if you were finished or wanted to say more.
No, I'm finished.
Thank you very much. And we certainly thank all the officers who have been out there protecting us and the public for their service. Want to acknowledge that as well as their families. And I'm looking to see if there are any members. Oh, I see Dr. Campbell. Dr. Jamali Campbell has her hand up. Dr. Campbell, the floor is yours.
Oh, thank you. Ms. Blue, I had a couple of follow-up questions for you. Can you mention the county that you reside in?
Hudson.
Hudson. And you mentioned about first responders, and you mentioned about communication. I wonder, did you feel that communications to first responders was sufficient in regards to their explanation and understanding in terms of getting information about vaccination? Do you have any insight or knowledge about that?
Well, I can say that my experience with the officers that I work with, I don't think the real communication was there, and it was really stressed the importance of having the vaccination. And while it does not prevent it, it does make it easier. I think that really the communication could have been a lot better all the way around, really, for officers as well as the community.
Thank you so much.
Thank you.
Is there anybody else from the task force that has a question for Ms. Blue? I don't see anybody. If there's anyone from the task force who I don't see, please speak up. Okay, then as the chair, I'm going to ask something which I really thought Dr. Campbell was going to ask. So I'm going to look at Dr. Campbell because she is a OB/GYN par excellence. And Ms. Blue, I'm just curious, you mentioned about some of the officers unfortunately bringing COVID-19 home to their family members. Did they say anything about perhaps if they're, if any of their partners, their wives, et cetera, may have been pregnant and gotten COVID or anything like that?
To my knowledge, no one was pregnant, but they certainly did bring the COVID home to their spouses and children.
Okay, all right. I just asked that because I know that's something that Dr. Campbell talks to us about all the time, about the exposure of women of childbearing age. So I just wanted to ask that. I thank you, Ms. Blue, for your comments and for speaking on behalf of the officers. Thank you for joining us this evening.
Thank you.
I'm not sure if there's anyone else who's waiting to speak. I don't, hold on one second. I'm getting a message. No, I don't see that anybody's waiting right now. I wonder, I want to ask my colleagues from the New Jersey Department of Health if this might be a good time to take a brief break.
Yes, this would be a good time.
Okay, then we're going to take a break. How long will that break be for?
15 minutes.
Okay, we're going to take a 15-minute break. It is now 6:47 p.m. So let's just say we'll reconvene at 7:05 p.m. Does that sound good?
Yes.
Okay, and while we're on break, you'll still, and Mr. Lisa, correct me if I'm wrong, you'll still be able to put your name in the chat if you want to speak. Also, if a person calls in and you dial *9, you can submit yourself into the queue. Is that correct, Julissa?
Yes, we'll still be here. We're just going to be muted.
Okay, great. If the folks who've already spoken are still, I see they're still on the line, I want to thank all of you again for sharing your stories with us. And if you know other people who want to share their stories, reach out, have them connect with us on Zoom or call in. Thank you very much. And I'm going to take a little break also. We'll return at 7:05 p.m. Thank you. Hello, everyone. Welcome back to the New Jersey COVID-19 Task Force on Racial and Health Disparities virtual New Jersey public hearing. I am Dr. Tanya Pagan Raggio Ashley. I'm the chair of the New Jersey COVID-19 Task Force. I'm here with the co-chair, Ms. Marilyn Centrone. Please, if you have any comments you'd like to make regarding COVID-19, racial and health disparities, experiences that you may have had in your community, your family, colleagues, or friends, please join us on Zoom and or you can call in at 929-436-2866. Our webinar ID is 856-5659-6288. And again, you can join us by Zoom or call in at 1-929-436-2866. And our webinar ID is 856-5659-6288. Okay, trying to see if there's anybody waiting to speak. I don't think I see anyone right now. In the beginning, our task force members did not have an opportunity to introduce themselves the way they normally would do at a public hearing. So I would like them to introduce themselves so that we have it on the record as they normally would have done for a public hearing while we're waiting for someone to speak. If someone should happen to join us while we're doing introductions, well, hopefully we'll get through the introductions before they speak, but we won't keep anybody waiting if somebody joins us and wants to give testimony. Ms. Centrone, would you mind introducing yourself formally? And
I am Marilyn Cintron from Alliance Community Healthcare and the co-chair of the task force, as well as the chairperson for the communications committee. I guess I'll hand it over to Aish.
Good evening, Ashia Hayes, Director of Policy and Planning in the City of Patterson, chair of the Historic and Systemic Inequities Working Group. I'll pass it to Eric.
Hi, everyone. I'm Eric Apar. I'm the Director of Legislative and Regulatory Affairs at the New Jersey Division of Consumer Affairs.
Mary Carl.
Eric, who are you handing it off to?
Marie Carl.
I'm sorry.
Hi, it's okay, Eric.
Go ahead.
Hello, good evening. Marie Carl Vilcius Talty, President and CEO at the Partnership for Maternal and Child Health of Northern New Jersey. I'm going to hand it over to Stephanie Gorman.
Dr. Damali, if she's there. Dr. Damali?
Okay. There's someone else from the task force who'd like to introduce themselves next.
Hi, my name is Amanda Medina Forster. I'm the Executive Director for the Office of Minority and Multicultural Health at the New Jersey Department of Health.
Thank you, Amanda.
Thank you.
Someone else from the task force like to introduce themselves? Okay. People may have stepped away for, oh, go ahead.
I was saying, I think that's all we have for now. Some people may have stepped away.
All righty. Well, we're waiting for other people to join us. I see that there's still people on who gave testimony earlier. I mentioned at the beginning that if people spoke and they wanted to speak again, they could do so after others finish speaking. Is there anybody on the phone who, I'm sorry, please forgive me, I'm a little tired. If there's anybody on Zoom or on the phone who has spoken earlier and wants to provide additional testimony, you could do so now. All right, so we'll just wait until someone else calls in, wants to speak.
I can't hear what anyone was saying.
Sorry, I took an extended break.
Dr. Campbell.
Dr. Campbell.
You work hard for the money. You
There's no
deserve
money.
it.
Where's the money? I'm waiting for my money now.
Oh, I think we're on the record. I'm sorry. I shouldn't say that. That was a joke. Forgive me.
Exactly, because we are special state officers that cannot be compensated
I cannot be
for our
compensated.
duties.
I'm sorry, I shouldn't have made that joke.
I know.
But you do work hard and we appreciate you, Dr. Campbell, OBGYN extraordinaire.
Oh, Dr. Raggio, flattery will get you everything.
Good, good, good. All right, we're on the record, so I will be making my comments in a couple of minutes.
I forgot David had to interpret all of that for us. Thank you, David.
David's cracking up. Is that your COO? You know what, like I said, she's what commented you. Hi, good evening. This is Dr. Tanya Pagan-Raggio Ashley from the New Jersey COVID-19 Task Force on Racial and Health Disparities during the New Jersey public hearing, the virtual hearing. Really want to thank everybody for joining us this evening and for your comments and cooperation. We really appreciate your interest in the New Jersey Coronavirus, Disease 2019 Pandemic Task Force on Racial and Health Disparities, and the time you took to be here this evening and share your very valuable input. As a reminder, as a very important reminder, the public comment period closes on Friday, December 16th. You can provide your comments now via email. You can also mail in your comments, and we placed that information earlier in the chat box. The task force wants to remind the public, please, the pandemic is not over. This was discussed earlier. And as you know, in reading the newspapers and the information from the CDC, COVID-19 rates have been increasing all over the country at about 22% from what they were 2 weeks ago, as well as hospitalization. So taking protective measures in our daily lives is still very, very important. Please, this includes wearing masks in public, social distancing, getting vaccinated. Vaccinations against COVID-19 start at 6 months of age. And please stay up to date with vaccine boosters. We have a new updated COVID-19 booster. If you have been exposed to COVID-19 or have symptoms, please get tested. If you test positive for COVID-19, there are medicines which may be helpful to you, as you heard earlier, but they must be taken within 5 days of testing positive, such as Paxlovid or mononuclear antibodies and remdesivir. We want to also remind everybody that it is influenza season. So please, 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 when you go for your COVID-19 vaccine, also consider getting a flu vaccination. As I said earlier, New Jersey has a wonderful, informative website, the New Jersey COVID-19 Information Hub. I use it every day, and you can access that website. We posted in the chat, but I'll say it for those listening on the phone at https://covid19.nj.gov/. It has wonderful resources in many different languages. You can also call if you prefer using the phone. For COVID-19 vaccination and testing, the number is 1-855-568-0545. Again, you can call for COVID-19 vaccination and testing at 1-855-568-0545, or you can call for medical COVID-19 questions at 1-800-962-1253. You can call for medical information for COVID-19 questions, 1-800-962-1253. You will be able to have medical questions and information from health professionals about symptoms, when to seek medical attention, and proper steps to take if exposed to COVID-19. The hearing is now closed. I'd like to say thank you, gracias, and in all of the beautiful languages we speak in New Jersey. Thank you very much, and good evening.
Thank you.
Thank you, everyone. Have a good evening.
Thank you.
Bye, everyone.
Bye-bye.
Thank you. Bye-bye.